what role have the IBD nurses been playing to address the concerns of patients with IBD overall here? And you talked a little bit about the Alberta biosimilar switch time and how you played a role at sitting down to the table with them. We know that the Alberta sort of put a hold on the switch and the tiered drug prescriptions, meaning we could give subcutaneous adalimumab, Humira, and before that we couldn't. So can you talk a little bit about what role nurses played in that?
Well, you find strange friends in strange situations. So like I commented earlier, I've been on weekly teleconferences every Friday with the Minister of Health's group since mid-December. And that's been it's been a long process of working with them, but it did provide a unique opportunity of really advocating for different resource utilization and actually having a working relationship with the Ministry of Health, where when issues came up around access, around coordinating not only care within the IBD community, but within the healthcare of how do patients access clinic for ambulatory care, how do they access urgent care or emergent care, and working with the Ministry of Health around some of those questions. Some of the big things I think that we were able to achieve was, at least for sure in Alberta, was actually getting Humira dropped back into a tier 1 drug. So if we were initiating a biologic therapy for a patient, that we actually had a sub-Q option in Crohn's disease. We didn't prior to COVID. And that probably was some of the bigger things that we did, as well as ensuring that there was access to PPE equipment to the infusion clinics once they were identified as an essential service. Then the Alberta Health also committed that they would ensure that there was a supply of protective equipment going into those facilities to really, create a safe environment for patients. And then I guess within our own group, we created urgent access programs where patients can come directly into clinic if they're experiencing concerning disease features, either through laboratory investigation or clinical experience. And we do a pre-screening clinic visit with them. And if needed, we bring them into the IBD clinic and they have access to sigmoidoscopy as well as ultrasound imaging. And to date, none of those patients have ended up going through the emergency department. I believe 3 have been admitted directly to hospital out of the clinic, but we bypassed emerge to bring them into hospital.
Great. And do other places that you work at have urgent care clinics, sort of an emergency way of getting in to see the doctor?
Yes. Here in Halifax, we've set up an urgent access clinic where patients are contacted or contact us if they have unusual or high risk factors. If we feel or we deem that they need to be seen, we see them in clinic, and we've set up with radiology urgent access CT that can be done same day, reported same day, and staff blood work, which we can get a report in about an hour. So we've been able to keep these patients out of emerge and prevent that emergency room visit altogether.
That's great. And Karen, what about in pediatrics? Is that any different?
So we didn't really label as urgent access care clinic, but as PRN or as needed, we would bring patients in quite easily. And we were sort of discussing the fact about patients' fear of coming in. So I think that's in the beginning, but like most of us have agreed upon, really, once we tell patients that they must come in for laboratory blood work, for imaging, all the resources are in place, and we've done it a few times where nurses do facilitate that in consultation with the physicians. And I think one thing that's also worth mentioning is that most of us in the panel here, we actually do have existing medical directives even prior to the pandemic. And so we're able to even order tests either outside, we'll review them, and if it's really, really urgent, we would bring the patient in. So we sort of have those avenues that we can tap into. Urgent care, either managed sort of by home or by community lab at first, and then bring them in if there's really value to seeing them in person.
And that does bring to the point, one of the questions that we got from the audience is, what would you say is safer, going to the hospital for blood work or for investigations, or going to a lab, an outside lab?
Oh boy, so maybe I'm a bit biased because I know for a fact that when I walk into sick kids is probably the most stringent, most strictest, hygienic practices that one can see. As of just a couple of days ago, for example, I can tell you all of our patients above 6 years old are required to wear a mask, including the adults. And the screening process is really more stricter than border security. So I think to me, if I was sort of to look at a hospital setting, I'm comforted to really encourage patients to come in. But I also have heard from families that labs or imaging centers in the community are as safe. But I think it's, if I was just to bring a point, that it's probably easier bringing a patient in to the hospital, just in case you pick up something in that laboratory blood work or in that imaging, you can sort of ask them to stay and do further investigative workup.
So it's Usha. I think for an adult world, it's a little bit different because we cannot get the patients easily into the hospital to have laboratory workup done. Having said that, I send them requisitions. I ask them to go get the blood work done. I have even emailed, so life labs, so patients that don't have access to printers, I have emailed Life Lab or any of the labs the requisitions, told the patient to go and get the blood work done, and I would get the results within 24 hours of them getting the test, and then you can act on it because you can still manage them remotely, and if there is anything that's showing up on the blood requisition, we can make changes accordingly.
Yeah, and I think it's worth noting that we talked about this a few weeks ago with the recommendations, but all the outside labs are governed by the ministry.
Yeah.
And so they need to be as safe, theoretically, as safe as the hospitals are, and maintain good hygiene. They also may have special times first thing in the morning, an hour before they open for everybody else, for vulnerable people who are immunosuppressed or in a, older age group, or have another chronic disease that make them at risk for COVID-19. So your local lab may actually be safer in that way because you can go at a time where fewer people are there and waiting.
Also need to know that the labs just don't let you go in. You have to make an appointment beforehand. So then they limit how many appointments, how many patients are there in the waiting area to get the blood work done. So it's safer to go to the lab, just as safe to go to the lab as well.